clarity on our way forward. But for right now, I'd just like to briefly introduce myself. My name is Sarah Onyango. I'm the Technical Director at IPPF, based in the office in London. I'm a medical doctor by training and previously worked at USAID in East Africa and also with PPFA and with IPAS. So I've been in the reproductive health field for several years now. Today I'd just like to take this opportunity to introduce our first speaker, Bulbul Sood. Bulbul Sood is a public health professional currently working with Jhpiego here in India. She has more than 40 years experience and was previously the professor of preventive and social medicine at Delhi's medical school for about 23 years. Dr. Sood has been Jhpiego's India country director since 2009. She has a strong technical experience in reproductive health, extensive program management experience, and is well known in the fields of family planning, maternal health, and reproductive health, both here in India and internationally. So I'd like to just take this opportunity to really welcome Dr. Sood to the podium. Thank you.
Good morning, friends. Namaskar. It's my proud privilege to welcome you all today to the IBP Asia Regional Partners meeting. It's nice to see several old friends and many new friends. And I'm so happy to see we have participants from Bangladesh, from Nepal, from Indonesia. We have colleagues from USA, from Geneva, and of course, several of you from India. So again, it's wonderful to be standing here, and I feel very privileged to be welcoming you all to this meeting where we have a common goal and initiative. Many in this room are aware about the IBP, but I thought, just to recap, and especially for some of the new members, what this IBP is. And as you know, IBP means the Implementing Best Practice Initiative. This was started in 1999, and we had 12 founding IBP partners, and I'm happy to say most of them are in this room. And can the founding partners can just stand up, if you don't mind, so we know how many of the IBP founding partners are in this room. Great. So as you can see, most of them are here. Currently, the IBP membership is more than 50 international and national partners and several civil society members, and WHO Reproductive Health Research Unit hosts the IBP Secretariat. So Nandita is representing the Secretariat at this meeting. Why there was a need for IBP initiative? And it was very simple that we wanted to all improve the family planning and reproductive health. But there were challenges, and everybody in this room knows we have a lot of evidence, we have the best practices, we have guidelines, but when it comes to implementation and practice, there was a gap. And IBP was created to bridge that gap, make sure that whatever is developed is very quickly adapted by the countries and ultimately leading to an improved reproductive health as well as family planning practices. How does the IBP work, What is, the ethos with which we are working? And I would just simply say that IBP acts as a magnet, creating network of organizations and agencies at regional and country level, working towards more effective results. So basically, and it's somewhere, like we have in this room people from several organizations. We all get together. We ultimately are interested in the same thing, how we can effectively and accelerate the results that we are all wanting to work towards. And we work in partnership, partners with the donors, with the NGOs, with the civil society, with the Ministry of Health in all the countries, several projects which are happening already. And, we have created what we call as country steering committee and mechanism so that, things could be accelerated quickly. By the way, I have borrowed these 2-3 slides from Maggie Asher Patel, who used to be leading the IBP initiative till almost, I think, 98. And she was, I would say, the mother of IBP initiative at the WHO. I see some people smiling. Irwin has been associated, and there are a lot of people in this room have been associated with the IBP initiative from the very beginning. So please bear with me when I'm showing these slides. Also, the IBP partners change the paradigm of learning. This is what we say. There is no one person who's leading this. This is everyone. It's a collective. It's a partnership that we are talking about. And we are talking about, creating communities of common interests, of best practices. And ultimately, it is sharing and exchanging experiences, how we can access the information when needed, build on the existing knowledge, and collaborative learning. So, for example, if the family planning wheel was, it keeps getting updated. So when it gets updated, it has to be quickly adapted by the country so that, you can remove the medical barriers which is there when you are giving contraceptives. And it is basically the, as I said, it's a common interest, it's catalyst for action, there is interactive methodology, sharing and exchange. In the next 3 days, you will find there are a lot of sharing of experiences, what have worked, what has not worked, how to do it, and sharing innovations also. We are not new. In India, we are not new to IBP initiative. And in 2003, it was launched in Agra for 4 states in India. And several of, I see people who were at the IBP in Agra are in this room also. But, that was the startup of our initiative in India. And India being such a large country, it was felt we had just covered few states. And following the Agra initiative, it was decided to hold another IBP regional meeting, which was held in Ranchi, Jharkhand in 2005. And again, with the same common interest, how we can share the experiences, how we can work collaboratively, and take the agenda of family planning and reproductive health forward. So this is the 3rd meeting that we are having in India. I'm again very happy to see all of you sitting in this room. Next 3 days, please spend time to learn from each other, share your ideas, share how you can collaboratively further improve our work, have a great time, meet with old friends, and also have a pleasant stay in India. Again, thank you very much for the IBP Consortium to give me this opportunity to welcome you all, and I wish you all the best. Thank you very much.
Thank you, Dr. Sood, for those warm welcome greetings, and we look forward to having a very excellent 3 days here in India. I'd like to introduce our next speaker, Nandita Thate. Nandita is from the IBP Secretariat, and she leads the Secretariat from the office in Geneva. Her current portfolio includes institutionalizing the role of IBP to support dissemination, implementation, and scale-up of WHO guidelines, and also strengthening the linkages between the IBP partners and WHO researchers to inform new areas for implementation research. Prior to joining WHO, Nandita was a technical advisor in the Office of Population and Reproductive Health at USAID, where she supported programs in West Africa, Haiti, and Mozambique. Nandita has a PhD in prevention and community health from George Washington University. Please join me in welcoming Nandita. She'll take us through our objectives and a look at the agenda for the week. Thank you.
Thank you, Sarah, and thank you, Bulbul, for that warm, warm welcome. I'm so thrilled to be here on behalf of the IBP Secretariat, and I just want to recognize my other Secretariat colleagues, Ados May and Osa Kuzinkil, if you could stand up. We're a small team, but we're a powerful team, and we're really happy to be here. Because we are so small, we rely a lot on our partners. And I would also like to recognize the group of partners who formed the planning committee for this team. So those of you who are on the planning committee, could you please stand? We had a range of partners represented on the phone every week, some folks at 7 or 6 a.m., and I just want to recognize them too for helping us put together this agenda. So thank you for that. Great. We have a very packed agenda, but a very exciting agenda. And I won't read through all the objectives, but I'll just say, the idea for this regional meeting here in India was actually born out of some previous efforts in the region. Our colleagues at WHO CRO held a regional workshop earlier last year where they convened country teams to talk about family planning in the region. Soon after that, our FP 2020 colleagues also convened a meeting in the region among their focal points. And after both of those meetings, we got a lot of feedback from some of our partners who said, these meetings were fantastic, they were excellent, but we want more. We need another platform where we can really interact and exchange with each other on how we are going to achieve these ambitious action plans and goals. And so the idea for the IBP regional meeting was born out of those. We have some very exciting activities planned throughout the 3 days. I'll just walk through quickly. This morning, we'll hear from some leaders in the region about their vision for the region, and hopefully we'll hear from Dr. Sikdar about the vision for India. We have a panel later this morning on connecting the dots. As we know, there are a lot of different initiatives happening in family planning in the region, and we want some clarity on how they can each work together and complement each other to help us achieve global goals. After the tea break, we'll have a moderated discussion with some donors and led by our colleague at IPPF to really understand donor perspectives and how do we balance donor perspectives with country needs. After lunch, our colleagues from Johns Hopkins CCP will lead us in an interactive knowledge cafe, which we've actually called an information exchange bazaar as a homage to the term that was used in one of the previous IBP meetings. So a little nod to some of you who were involved in IBP before. You can see there's a range of tools and resources that we'll be featuring, so we encourage you to interact, exchange with others, learn about some of these different tools and guidelines, and help us disseminate these resources into your country programs. In the evening, we have an interactive reception and networking event planned by our IBP Adolescent Youth Task Team, Pathfinder and PHI. And that should be a really exciting activity, a way to really engage and get involved in some more networking. Tomorrow, in the spirit of true partnership, will be chaired for the day by Meenakshi Jain from IntraHealth. And we'll start the day with a panel on documenting and really telling the scale-up story. So we'll hear some innovative approaches on how better to tell our story. In the morning and afternoon, we have 2 concurrent sessions, and they will be repeat sessions. And these are the technical sessions, one on expanding method mix and one on engaging young people. And as I mentioned, this agenda was really developed collaboratively, and these were 2 topics that really rose to the top as priorities for the region. So we're excited about a range of presentations and panelists in those sessions. In the afternoon, we'll hear a little bit more from Dr. Sarah Nyong'o about IPPF's vision as the new chair of IBP. And then we will be introducing some of our newest IBP members. And we're excited to have some of them here with us so we can hear more about how to engage with them. Finally, on day 3, we'll be chaired by Franklin Paul from Restless Development, a local organization. And we've planned something really unique for this meeting in that we've partnered very closely with the FP 2020 Civil Society Focal Point here in India, Population Foundation India, and have actually supported them to lead and organize a session on the 3rd day focused on civil society engagement. The afternoon, we will have the long-anticipated launch of the updated Family Planning Handbook. And we have some copies, so do stay for that. We have experts from WHO Geneva who will be going through some of the key updates, and we'll be organizing an interactive session on better understanding the handbook. And with that, we will have a closing reception on the 3rd day. So as you can see, we have a very packed agenda, but a very exciting agenda. So we look forward to lots of discussion, interaction. For those of you who are online on social media, we encourage you to post pictures, tweet, Facebook, do whatever you do. We've got some hashtags down at the bottom. So please, let's get the word out about IBP, about this amazing partnership and the work that we're doing over the next 3 days. With that, I will turn it back over to Sarah. Thank you.
Thank you very much, Nandita, for taking us through the agenda. It's a packed agenda, but an opportunity for us to engage, to share, and also to interact. And hopefully at the end of 3 days, we'll have achieved all that. Our next session is a special section. It's, we have a panel, and I'd like to invite the panelists to the table. We have 3 panelists. The first one is Anoma. I'm going to test my pronunciation of Indian names. Jayathilaka. Yeah, please welcome to the table. We also have Varun Anand from IPPF and the Deputy Commissioner at the Ministry of Health and Family Welfare, Dr. Sidka. Please welcome to the podium. The 3 panelists. The first panelist is from WHO, Anoma Jayathilaka. Dr. Jayathilaka has an executive experience as a national program manager with the Family Health Bureau at the Ministry of Health in Sri Lanka, where she worked prior to joining WHO in 2006. And has an extensive experience in maternal and reproductive health. She received her MBBS from the Faculty of Medicine at the University of Colombo in Sri Lanka in 1983, and she holds a postgraduate diploma in community medicine. In 2007, she received an award by the Ministry of Health in Sri Lanka in recognition of her contributions to the National Maternal Health Care Program, and she's also a co-author of several publications. Please join me in welcoming Dr. Jayathilaka. Yeah, thank you.
Thank you. Thank you, Madam Chairman, and good morning, and very warm welcome for all of you. And Dr. Sarah Horengo, the Technical Director, IPPF, and Dr. Sikda, Deputy Commissioner, Ministry of Health, Government of India, and Dr. Varnananand, IPPF, and also Dr. Nandita and Dr. Bulbul Sud, my friend, and all distinguished participants, ladies and gentlemen. It's with a great pleasure that I represent the World Health Organization Southeast Asia Regional Office in this very significant meeting. As we all know, I don't think I need to tell about the importance of family planning in this gathering. So then it's really not matching. So all our family planning gurus here. So, but we know that family planning saves life. It's quite touching for me, and because my main background is maternal and newborn health, and then so family planning is always linked into that. And the women's ability to space her and her limit pregnancies has a direct impact on her, as well as unborn babies' survival, health, and well-being. In 2012, published Lancet paper highlighted globally when the CPR contraceptive prevalence rate is more than 65%, proportion of maternal death averted also more than 60%. So it's quite applicable for our region, because our region maternal and newborn mortality is very, very high. If you look at family planning on very, in a, how can I say, in a survival aspect. I'm not going to talk about other things. And it is essential, family planning is an essential component of the Sustainable Development Goal, SDG, and viewed as a best bias in the development. I'm not planning to explain all other advantages of family planning for this learned gathering. The 2030 Agenda of Development include many targets and references to gender equality and women's and girls' empowerment. Sexual and reproductive health and reproductive right, which goes well beyond the commitment of the MDG. So the MDG era, we didn't talk much on this. And the SDG makes specific reference to family planning in goal number 3 on health and goal number 5 on gender equality and women empowerment. Corresponding to the SDG indicate on family planning in WHO Southeast Asia region in 2017, 68% of women of reproductive age who were married or in union had their family planning need met with the modern contraceptive methods. Yet, wide variations are found across countries, from as low as 38% in Timor-Leste and 43% in Maldives to as high as 89% in Thailand and 85% in Bhutan. So furthermore, with more than 350 million adolescents in our region, we need to address their sexual and reproductive health needs. The adolescent birth rate in our region in 2017 was 40 per 1,000 adolescent girls aged between 15 to 19 years, with rate as high as 113 in Bangladesh and 88 in Nepal. So wide variation is in achievement among countries and within countries. So our regional director of Southeast Asia region has declared 8 flagships to achieve the MDG era. The ending preventable maternal and newborn mortality is the 8th flagship priorities for the WHO Southeast Asia region. And so access to available and acceptable and good quality modern contraception is an essential element to address mortality reduction. So then we linked even with the regional directors, this flagships area is quite linked with the family planning promotion. So in this new era of development, WHO is working as a one organization at global, regional, and country level by providing leadership in health, especially provision of evidence-based norms, standards, and guidelines is as one of our major co-functions. So WHO primary role is assisting member states to plan effective context-specific policies, strategies, including a systematic approach to implement evidence-based national family planning guidelines, standards, and protocols within a national program. On view of that, in April 2017, WHO CRO convened a meeting in New Delhi in collaboration with WHO Headquarters Umbrella Project, where Dr. Rita is in charge, and bringing together all our member states, ministries of health in the region to disseminate WHO updated guideline on medical eligibility criteria and selected practice recommendation, SPR, and also share country experiences implementing on family planning programs. In addition to representatives from ministries of health of 10 member states and WHO country office staff, UNFPA, JPIGO, USAID, BMF, and some more partners and professional organizations were also invited and contributed immensely in this meeting. I think most of these, I can recall that there were participants in that particular meeting. As an outcome of this meeting, technical and financial assistance was mobilized not very much because we are not very rich, but if you work together, you can mobilize a lot of things. So mobilize from our member states through the WHO HQ regional office and country officers and other partners. And so we had achieved some products. So what are those? But not reinventing the wheel. So almost out of our 11 countries, 8 countries has updated their existing national guideline. I think Dr. Arvind Mathuris, we already discussed even in the Maldives, is one first country pushed into the updating of national guidelines. So out of that, all 8 countries is now has updated MEC, SPR, and all these tools. And also other 3 countries are in the process of updating in 2018. So incorporation of WHO updated recommendation of MEC and SPR and align their family planning and the SDG instead of creating parallel structure, that was the main thing. But whenever the guidelines and product at HQ and regional level need to translate into the national guidelines. So no point we are just releasing guidelines at the HQ level or a regional level. If it's not incorporated into the national guidelines and it will not translated into the actions, so it's only a book lying in a shelf. So I think this meeting is very, very important. All implementers and then people who push into, translate this into the actions are here sitting together with the ministries. So that was the main, I think, achievement we have achieved after that meeting, so still going on. Then also that we capital out from that by identifying the opportunities to work in partnership with FP 2020. In our region, out of these 11 countries, 9 countries are FP 2020 countries. So this was a booster. This meeting was a booster for them to think about, again, the countries who have not made commitment. I know that Sri Lanka is now making commitment. Bhutan is now working on making commitment. So the countries who have not yet made commitment, who took this as a booster after this meeting. And other thing is, there are a lot of new innovation has come. So I can even share that Indonesia has developed mobile app on MEC, this wheel. So now it's available in the Apple Store and Android Store. The Maldives is on developing in the process. Sri Lanka is in the process. So there are a lot of innovation has come out. I'm not going to list out all these things as a momentum of this meeting. So there are so many other activities are ongoing, including capacity building. So we are planning the capacity building with the TRP package in the region also. The Zero meeting was a significant milestone and opportunity for us to build capacity and ensure the appropriate implementation of relevant family planning programs at the national level so that global goals can be achieved. I understand this meeting of IBP, as Dr. Bulbul should explain very well, and is also planned on the same objectives, but the focus is beyond ministries of health and the UN organizations to support the implementation and scale up of foster partnership. So this is very, very important. Family planning has so many, the demand side factors, and then so we have to work together. So I think this, she very well mentioned about how to fill the gap between practice and this. I think we are, all 3 days we are gathered here to do this. IBP as a platform to convene these partners is essential to achieve this goal of wider dissemination and practice of guideline and best practices. So the most important thing is the best practices. Guideline is a guideline, but you can put into the practice in a more innovative ways. So one method may not suit for the all, but they may be creatively think about how you can implement this recommendation in a different method. So IBP has a special relationship with the Zero. I think she mentioned that first IBP meeting was in Agra, and then after that 2005 there. So there's a long-standing partnership and platform for implementing partners together, network and exchange experience on the what works in family planning and reproductive health. So therefore, this partnership has also been valuable in helping us in global family planning community reduce duplication and facilitate collaboration and partnership. Today, with increased investment in family planning and important partnerships like FP 2020 and others, it's great to see IBP is forging ahead and making important linkages to ensure all implementing partners here are complementary and aligned to achieve our common goal, that high quality family planning and reproductive health services for all women, girls, and families in the region. So I really value and appreciate that the work that you are working on this, expanding beyond ministries of health and linking all these, whatever the puzzles you need to fix. At last, I like to thank organizers for having this meeting in our region, and we look forward to continuing our support of IBP from the WHO Zero region and look forward to hearing from the partners here over the next 3 days about your innovative approaches at country level. Thank you.
Thank you, Dr. Jaya Tilaka, for your very informative presentation. I'd like to move on to Varun Anand from IPPF, South Asia Regional Office. Varun is a chartered accountant with more than 25 years of diverse and multidisciplinary experience. His commitment to a just and equitable society has helped him pursue the course of building an empowered community, which he believes is the only way to inclusive development. As a member of IPPF's global leadership team since April 2017, and the senior management at IPPF South Asia Regional Office since March 2010, Varun has championed the cause of sexual and reproductive health and rights for all by building accountable, transparent, and robust, locally owned, globally connected IPPF. I'd like to welcome to the podium Varun Anand. Thank you.
Globe, and we are locally owned, as Dr. Sara said, and globally connected civil society movement, creating a mass groundswell of well-informed people who can claim rights and hold their leaders to account, provide and enable services, champion SRH for all, especially for the poor and vulnerable. IPPS stand committed to working in partnership with communities, governments, parliamentarians, donors, and other stakeholders to ensure that all people are free to make choices about their sexuality and well-being in a world free from any discrimination. The global FPSRH community has set a number of ambitious goals, as we know, and targets related to reproductive health. Since 2012, FP 2020 has a target set for reaching 120 million new users by 2020. IPPF 2, as a lead SRHR organization, has made several notable commitments, including expanding its outreach to 60 million new users of family planning by 2020. It is obviously not going to be business as usual as we go forward. Reaching these goals call for collaborative action, using evidence-based practices and a systematic approach for scaling up. And IBP is well placed to address the knowledge exchange and collaboration for all these needs. IPPF has been leveraging the learning from partners of the IBP initiative in designing, implementing, evaluating, and improving its programs and other efforts, including evidence-based advocacy and collaborative partnership. All these years, IPPF has pioneered in providing integrated services to poor and vulnerable communities and groups. We have been successful in implementing and scaling up high-impact practices like postpartum family planning, post-abortion family planning and immunization integration, expanding mobile outreach services, social marketing at our service delivery points. Along this, we have also improved investment to promote programs to integrate economic empowerment with family planning, enhancing service delivery capacity of community-based health workers, and in contraceptive security and strengthening health systems. Nothing short by saying data-driven programming has been another very critical thrust area for us. We have understood the importance of scale and quality of program data and have been working with our member associations in strengthening institutional process to collect, collate, and utilize data for programmatic decision-making and quality improvement by setting up data collection, collation, and analysis systems across the member associations in the South Asia region. Along with sexual and reproductive health and rights and gender equality, youth, as Dr. Tilika said, youth empowerment is at core of our work. IPPF embraces youth center programming approach by expanding our commitment to youth friendliness and evolving to ensure young people are truly at the center of everything we do. IPPF continues to set an example for meaningful youth involvement by genuinely focusing on young people's lives and requirements from their own perspective, delivering services, programs, and interventions that are truly designed and developed by them, and thus relevant and inclusive and effective. Our investment of building an enabling environment for adolescent youth programming includes ensuring legal rights, policies, guidelines that respect, protect, and fulfill young people's human rights to access SRHR information, products, services, and comprehensive sexuality education, regardless of their age, sex, marital status, and parity. IPPF has also been working relentlessly towards positive policy change for providing sexual and reproductive health services through its service centers. The enthusiasm, attention, and guidance of all our partners and supporters helped IPPF and its member associations to contribute to numerous advocacy changes. Some of them have recently been mentioned, and Dr. Mathur has been involved in one of them in Maldives. Among many, these policy changes, passing of gender equality bill in Maldives, adoption of national strategy for elimination of child marriage in Afghanistan, amendment in the marriage law in Bhutan, adoption of national policy to address gender-based violence in Sri Lanka, increased funding for female sex workers, health in HIV program in Iran, 12% increase in family planning budgets in Nepal, and Child Marriage Restraints Act in Sindh, Pakistan are some that are worth mention. All these would not be possible without the support from the government agencies, donors, and diverse partner base. We have endured long-lasting partnerships with diverse national, regional, global organizations, consortiums, government and quasi bodies, and some of them to mention organizations such as SciVag, FOXY, Reproductive Health Coalition, and many more. In closing, I want to once again thank you all for your engagement, expression of commitment, and hope. This meeting all provides interactive knowledge exchange and networking opportunity to improve family planning and reproductive health outcomes. It has been a pleasure to be with you on this August occasion. Thank you so much.
Thank you very much, Varun, for those highlights, all that provide us with a good platform for our discussions later. Our last and final speaker this morning is a very important person representing a key link we have with government. So our speaker is Dr. Sikdar, who's a Deputy Commissioner with the Ministry of Health and Family Welfare in the Government of India. Dr. Sikdar is a medical doctor and a postgraduate in public health. As a technical lead and head of the National Family Planning Program, he plays a major role in policy formulation, strategic management, program implementation, and monitoring. He has been instrumental in advocating and implementing strategies for popularizing family planning and spacing methods in particular. His prudent and sincere efforts have not only helped scale up family planning services in the country, but also contributed to improving maternal, child, and neonatal care. Please join me in welcoming Dr. Sikdar. Thank you.
dear Sarah, Anuma and Varun on the panel, and colleagues, friends, partners from across the region, as well as I can see from many parts of the world. Welcome to this 3-day, what should I say, brainstorming session on the IBP initiative. And I bring to you greetings from the Government of India. And since I've been asked to speak over here, and it's very pertinent, probably you want to know what India is doing. I could see Anoma talking about the Sierra activities. I could see Varun talking about the IPPF activities. And it's not out of place for me to say what the Government of India is doing. Before that, I just want to express my gratitude to WHO, because this has been one of the organizations which have been supporting us since the time I joined the ministry. That was about 12 years back. Is this working? So I don't need to carry this one, right? Thank you. Yeah. And it used to be a very strong partner in helping us in developing our technical manuals. Many of the initiatives that we have taken, some policies, some programs, have been fed in by evidences from WHO. It has strengthened our justification for introduction of new contraceptives. So from that angle, we really need to congratulate WHO. Of late, it has been a little bit weak, as Anuma mentioned, that we are not that rich. I believe nobody is that rich anymore, especially the family planning community. For the last 2 to 3 years, the funds are not really forthcoming. And then we talk about IBP, the implementing best practices. This is an initiative, again, under the umbrella of the WHO, having the organizations like UNFPA, USAID, and the partners. Many of you are sitting over here. It's a synergy of all these organizations, and it's testimony to the partnership that we are having over here, that countries around this region and across the world have been able to push forward and move ahead in family planning. At the Government of India level, we value the partnerships. We treasure the discussions that we have with you, while maintaining the confidentiality that a government requires, a sovereign government requires. To the extent necessary, we are as transparent as possible. That has been the tenet of the Government of India. We will go ahead with what is the will of the people of India and push the program forward with the support of all the partners. I would like to make a very small presentation on the strides that the Government of India has taken in family planning. Very proud to say that we have been able to push forth many, many things over the last 5 to 6 years with the support of all of you present over here. So we are not really shy of acknowledging the contribution of all the partners sitting over here, and we are also open to meeting you whenever you require or discuss something with us to take the things forward. So regarding our approach to family planning, the first thing which comes to mind is a fertility trend. It's not an indicator for family planning as far as the program looks at it, but our government looks at the fertility as one of the most important indicators to be monitored under the National Health Mission. Suffice it to say that we have done pretty well on the fertility front. We are at 2.2 as per the NFHS, knocking at the doors of 2.1, which is the replacement level that we are aiming to. But considering that we still have a considerable, rather a high infant mortality rate, even 2.2 can be considered to be a replacement level. More important, on this slide, which has been provided to us by Track 20, you can see that the demand satisfaction level on the right-hand side, the green part, as of now stands at 73.6. We had aimed to reach around 74% till 2020, as per the targets we set for ourselves for the FP 2020 goals. And we hope to reach it by 2020. Because even a single percentage increase from this level onwards takes a lot of effort. Although we have a very ambitious goal of 90% by the end of 2030 as part of the SDG goals, but I don't think I don't think I'll be around at that time to see whether we reach or not. But what we can do right now is that work hard to really make it easier for people who will come down the road to take it to 90%. We've done wonderfully well on some of the indicators. If you look at the NFHS figures between the NFHS 3 and NFHS 4, we have been able to reduce our teenage fertility by half. It's an extremely significant indicator that we have been able to do. And family planning program has contributed because we have schemes built in for these particular teenage fertilities. Even the teenage marriage, you can see, is almost halved over the last 10 years. That, again, is a very significant milestone that the country has achieved. In terms of the dividends to our country, again, this is not Government of India's figures. These are figures computed by the Track 20 under the FP 2020 umbrella. And we can see that as of today, or rather in 2017, 136 million women were using modern methods of contraceptives in India, as a result of which 39 million unintended pregnancies have been prevented, 11 million, or rather almost 12 million unsafe abortions have been prevented, 15 million total deaths have been averted, and most significantly, and this is the most rallying point for us to rally with our program, our bureaucrats as well as our politicians, that we have been able to avert 42,000 maternal deaths, which is very significant for a country like ours, which means that our maternal mortality would have been double than what it is as of now. So these are stark, strong data which really helps us to get the leverage from the absolute policymakers of this country, because we have to discuss with them, advocate with them, cajole them into supporting the program. And these are the ones which help us a lot. Moving forward, we were one of the first countries to jump on the RMNCHA bandwagon. In fact, the A part was started by us. We said RMNCH plus A way back in 2012-13 itself. And not only did we jump on the bandwagon, we really developed a management toolkit, which is very popularly called 5x5 matrix, where we have a set of interventions followed by a set of commodities, and also the terms of reference that each of us have to do in all the pillars of the RMNCH. And this is the one where we said that we'll be having more focus on the spacing methods, especially the interval IUCD. At that time, the PP IUCD was not really doing that well, so we put interval IUCD at that time. And then we have certain other programs like the community health workers program built into this particular pillar. In terms of the policy, we haven't changed much, and we are true to the policy. We do not have a target in our country, and we just promote voluntary adoption of the family planning methods based on the felt needs of the community. And then at the service level, there has been a major shift. We do not anymore promote sterilization as our #1 program. That does not mean that we do not support sterilization, because we talk of reproductive rights. If a couple wants a sterilization method, we as public health persons are duty bound to provide that services. And that's what we are sticking to. And in spite of all this, we are able to manage, or we are able to maintain the numbers that we have been doing, around 4 million sterilizations every year, even now. Having said that, Spacing is the cornerstone of our family planning program, and it has been spacing, spacing, and spacing ever since. The key strategies that we have in our country: the expanding basket of the choice, which we have done; promotion of post-pregnancy family planning. Again, it's our #1 strategy. Adopting fixed day strategy as against the camp approach or need-based approach. Supply chain strengthening has been another area where we have worked very, very strongly, and I'll tell you later on how we've done that. Advocacy at all levels have increased, whether at the government level, at the bureaucracy level, at the program managers level, and as well as support from the civil society in terms of advocacy for the program. We have included the communities, the community health workers to specifically. We have enlisted them as part of our program. So we have certain schemes built around them, like the home delivery of contraceptives, ensuring spacing of births, and distribution of pregnancy testing kits. And we have had a very good IEC campaign over the last 3 years. We had not only the first phase, which was championed by our brand ambassador, Shri Amitabh Bachchan, and we also have the second phase of the communication campaign running right now across the country. I've been told that it is one of the best awards in terms of the advertisement by some advertising agency conglomeration here in India. We've also really put our efforts a lot on the adolescent part, the family planning for adolescents, which has been one of the missing pieces. I won't say over here that we have succeeded very much in that, but we are still taking great strides into this arena, providing information to the community, the adolescent community. We are training the health workers for counseling and increasing the access. The emergency contraceptives access has been increased very strongly, and also strengthening our abortion and post-abortion care. In fact, we also have, in addition to the postpartum family planning, the post-abortion family planning has been one of our main agenda over the last 1.5 to 2 years. Down below, you can see the community-based interventions to increase the contraceptive access, where the community health workers move from place to place to distribute condoms in the hinterland. And to many of your surprise, this program has been a moderate success in at least 12 of the 24 states, major states of our country. Scheme for ensuring spacing of births, this is doing wonderfully well. We have been able to spend a lot of money on this, and as a result of that, our spacing between births is now increasing very much. It's around 60% now, 3-year spacings. We are also providing pregnancy testing kits at the village level, at the ground level, to help the ASHAs, our community health workers, as well as the clients, to find out whether they are pregnant, and if it's an unwanted pregnancy, they can go for an abortion, or if this wanted pregnancy, they can go for delivery, or they can get enrolled under the Janani Suraksha Yojana scheme. We have the concept of peer educators, which is in massive numbers across the country, and also counseling for in-school and dropouts through adolescent health counselors. Coming to addressing the access and demand simultaneously in family planning, we have been successful in really introducing 3 contraceptives: the injectable contraceptives, the Centromin, and the progesterone-only pills. The third one is right now in a pilot mode. We are not in a position to share the details of it, but I'm hopeful in the next 4 to 5 months, we will be hearing something about it, which we will then disseminate to you, to this particular group of people, about the outcome of that particular project. And this injectable contraceptives we introduced officially in 2016, but since the commodities came late, we actually started about 3 months back, and it's already been scaled out or rolled out across the country in all states of India. And also, we have been able to secure domestic funding for this particular commodity, which again is a sort of a self-reliance that the government of India believes in. We've also launched the Mission Parivar Vikas, one-of-a-kind mission. It was mentioned in the Parliamentary Standing Committee meeting that we had yesterday in front of our standing committee, which provides a budget for the Health Ministry, where we are targeting around 146 districts which have got poor family planning indicators, with added sort of an effort to really provide, to ensure that services are provided to these 146 districts in a very focused way. We've also devised this software for family planning logistics. Again, very proud to say that we have been able to do in a very short period of time. We got the permission somewhere around February last year. And it's 1 year of time. Not only we have been able to develop that software, which has taken us around 7 to 8 months, and right now we have been able to complete trainings in every state of India. And in fact, the states are reporting their ground stock entry through the web-based system that we have. We have done away with the physical indents from the states. This is one area where we have done wonderfully well, and it is really going to help us in managing the supply chain management of commodities for family planning, which was never really there in the system previously. Sorry. Regarding the communication campaign, we did some basic research. We went to states, did some field research, and came out with the issues which need to be addressed. And these were the 4 primary issues which came out of the discussions. One was the increased spousal communication, delay in the first child, then the introduction of new methods, and role of men. And in a scientific way, what we did, we went around these particular 4 communication areas and developed our software, which are actually TV commercials, prints, posters, then there are audio visuals. What we have been able to do is that right now, we have a dedicated helpline. You can see the number there, which addresses issues on family planning all across the country. Prior to this rollout, we were having around 200 calls a day from this call center. Right now, we are addressing around 1,600 calls a day, which is a huge success. We have increased the seats over there. Instead of the 8 seats we had now, we have made around 20 seats around the clock. We also have a dedicated website for family planning, one of a kind. It's not there for any other program in India. And this website is something, again, which is disseminating information on family planning to the lay people in a very simple language. And also, it also includes all the activities that we have in the family planning program. We might upload this particular meeting that we are having on this particular website by the end of the day or by end of tomorrow. Then we have the television commercials, which have been done with famous cine stars, celebrities, and also WhatsApp videos, which has been celebrity WhatsApp videos, which we are circulating through the WhatsApp. And we also have outdoor campaigns and also mobile vans promoting family planning. As I was saying, that we have gained from the support of WHO and other technical agencies to give us, to help us develop our guidelines. We have been able to update all our technical guidelines, and we have tried to be as consistent as possible with the WHO recommendations, and we have incorporated them into our various guidelines, whether it's on female sterilization, male sterilization, whether it's oral contraceptives, injectable contraceptives, whether it's IUCDs. And also one thing is the MEC wheel, you know. This is something which every time it comes out of WHO, we adapt it to our own national interest and then publish it and spread it across the country. We also have translated it into our local language, Hindi, for better use. And this wheel is actually something very much in demand. You may not be knowing it. It's very much in demand across the country, and we get requests from many states to circulate these wheels to them because they find it very useful. Coming to the global commitments, yes, I did not mention FP 2020 right at the outset, but the fact of the matter is that the government of India actually had a paradigm shift in 2010-11 onwards in family planning, where we moved away from the population agenda to the mother and child agenda. And we were actually going very much forward on that, and at the opportune moment came the FP 2020 movement, which really added wings to our program even further. It helped us to really gain mileage. It helped us to develop state plans. It helped us to develop even district plans. That was the minute way that we went into developing our family planning 2020 plans. So every district in the country, we have a district action plan for family planning under the umbrella of the FP 2020. And FP 2020 has been really of help to us, if not in anything else, in advocacy as well as in supply of some contraceptives. What we did in 2012 was from the platform of 2012 FP 2020 at the London meeting, we made an announcement that we are going to commit or allocate $2 billion in family planning till 2020. Now at the halfway anniversary of this FP 2020 movement in 2017, our Secretary of Health, Mr. Mishra, made an added comment and commitment over there that the government of India wishes to allocate $3 billion on family planning till 2020. And I must confess over here that we are very much on track on that, and we have actually already spent $1.85 billion till 2017. So we are very much on track because of the expected increase in the budget over the next 3 years. We will be able to not only reach, but surpass that figure also. We've also committed in our annual action plan that our increase of CPR would be around 0.4%. You would appreciate that we are at the top of the S-curve. It's not easy for us to increase the CPR beyond a certain point. Even there, we thought that probably the one that which is doable and not just a sort of a tall order, is that 0.4% is something we will be able to achieve, so we have committed to that. And also, we want to increase our demand satisfaction level from the present 73.6 to 74%, which we feel that we'll be able to achieve. And as mentioned by Anoma also, SDGs 3.7 and 5.6, this is very much part of our policy document also. In our health policy document, we have mentioned about this, that we will ensure universal access to sexual and reproductive healthcare services, including for family planning, information education, and the integration of reproductive health into national health strategies and programs. So this is something which we have committed in our policy document, so we stand by that. And there are certain best practices and innovative approaches what we have done. If you see, we have a scale-up of the postpartum IUCD services. As of today, it's around more than 5 million insertions have been done since inception till January 2018. Now, the best part of it is that out of 36 states, around 28 states have done it on their own. And that is the greatness of this particular program that we have been able to do. It's absolutely self-reliance. We have taken advantage and support from the implementing partners and technical agencies sitting over here. But then, what we have been very conscious of, that we have to develop our integral capacity, which we have been able to do. States like West Bengal, states like Haryana, states like Tamil Nadu, states like Karnataka, they have done wonderfully well in this PPI-ICD, even if there is no partner there. So we have been trying to have this model that we have the stimulation from the partners, and then actually have a sort of a self-reliance on each of the initiatives that we talk about. In terms of expanding basket of choice, this is something ultimately had to be done, and we had, again, very proud to say, done it on our own. We have been able to roll out the injectables all across the country, and we have been able to reach our commodities to each nook and corner, including the difficult Northeast as of today. Community health workers is another area where we have worked very strongly. And then also the differential funding for hard to reach and difficult areas. So this is a tenet of the National Health Mission. We provide them 30% additional budget. Also for the Mission Parivar Vikas districts, which is 146, there too we provide around 30 to 40% additional budget for family planning. So these are the best practices, some of the best practices. There are 3 or 4 over here. We are not listing it over here because we still have to get evidence of those, say in the next 1 to 2 years, when we'll put them into best practices list. So the principles that we have with the partnerships and the integrations, we have partners who help us in advocacy. And most of you are sitting over here. We have partners who give us technical support. I don't need to enlist or rather roll and enumerate the names of the partners because there are so many of you over here. And then we have partners who are implementation partners. We have partners who help us in monitoring and evaluation. And we have partners who help us generating evidence and to feed into the policy formulation. So these are the list of the partners. If you see at the top, the prime donors we have, the agencies, and then you can see where your name figures. I think it's a comprehensive one. If somebody's name is not there, please come back to us. We will put your name next time. Maybe I missed out one or two, but these are the ones with whom we liaise very commonly. And we are very proud to say in all our presentations, if it is of a regional level or international level, to mention very strongly that family planning is key to achieving sustainable development goals. We actually have come out with a presentation which says that family planning affects each and every of the ones or the 17 indicators mentioned in the SDGs, either directly or indirectly. So then what is our focus? Increasing access to quality family planning services for better maternal and infant health outcomes and overall development. Thank you so much.
Thank you very much, Dr. Sikdar, and to our entire panel this morning. I don't want to really summarize what they've said, but I think they have set the agenda for us very well, coming from the global picture that was presented by Dr. Jayatilaka, where WHO, highlighting WHO's leadership and guidance. Dr. Varun also emphasized the importance of access and reproductive health and rights. And then finally, in the presentation of Dr. Sikdar, we have seen how it's put into practice and the work that is happening here in India to ensure access to family planning for all. So these presentations really present the foundation for our work in the next 3 days. I encourage you all to follow up with them, engage further during the breaks, ask questions, etc. So I'd like to just ask you all to thank our presenters. Yeah. Thank you very much. And, please feel free to do that. I will not open the floor to any questions to the presenters, so I will just let them take their seats back. Yeah. I'd like to welcome the next panel. Thank you very much. The next panel is going to be moderated by Vineet Sharma from UNFPA, so I'm happy to hand over to you. Please welcome to the podium.
One more chair.
Good morning, friends. I feel privileged to be moderating this important session, which is on connecting the dots between partnerships.